medical billing, coding and claim adjudication of COVID-19, coronavirus, claims. WHO has declared a global pandemic from the novel coronavirus known as COVID-19. As a result, the federal and state governments have declared a state of emergency, which has resulted in a host of state and federal coverage and benefit levels mandated for health plan companies. In response to the government declarations, payers had to go back and review their reimbursement provisions, contracts, and had to determine that in order to meet the newly required mandated benefit levels, implementing an emergency reimbursement policies to pay fixed rate for all COVID-19 diagnostic testing to all providers, whether participating in network or not, is the best possible solution. Given the present scenario, you cannot escape billing, coding and adjudicating COVID-19 claims. To ensure you are equipped to handle these claims, mentioned below are the latest updates on billing, coding and reimbursement of COVID-19 claims. COVID-19 diagnostic testing reimbursement. The Centers for Medicare and Medicaid Services, CMS, has established two healthcare common procedure coding system, HCPC, codes for coronavirus testing. HCPC code U0001 is for Center for Disease Control, CDC, approved labs to use, and HCPC code U0002 is for CDC, non-approved labs to use when reporting SARS-CoV-2 testing. The CMS has established two new HCPC codes for high-throughput technology screening. HCPC code U0003 and U0004 are to be used when making use of high-throughput technologies, as described by CMS. HCPC U0003 and U0004 are effective for high-throughput technology testing, effective on and after 14th April 2020. Backbencher note: high-throughput technology screening, HTS, is a method for scientific experimentation, especially used in drug discovery, and relevant to the fields of biology and chemistry. Using robotics, data processing, control software, liquid handling devices, and sensitive detectors, high-throughput screening allows a researcher to quickly conduct millions of chemical, genetic, or pharmacological tests. Through this process one can rapidly identify active compounds, antibodies, or genes that modulate a particular biomolecular pathway. The results of these experiments provide starting points for drug design. CMS has established new specimen collections codes for laboratories billing for COVID-19 testing. Clinical diagnostic laboratories should use these codes to identify specimen collection for COVID-19 testing, effective with item date of service, on or after March 1, 2020. These codes are billable by clinical diagnostic laboratories. HCPC G2023 for specimen collection, for severe acute respiratory syndrome, any specimen source, and HCPC G2024 for specimen collection, for severe acute respiratory syndrome, from an individual in a skilled nursing facility, or by a laboratory, on behalf of a home health agency, any specimen source. The AMA published CPT code 87635, in an effort to help report and track testing services related to SARS-CoV-2, in an effort to assist in reporting and reimbursement. Almost all of the payers' reimbursement rates are based upon rates that were recently announced by the Center for Medicare and Medicaid Services for COVID-19 testing. Payers will reimburse all contracted and non-contracted providers for COVID-19 testing, unless otherwise specified by law. Reimbursement rates for coronavirus diagnostic testing. HCPC U0001, $35.92. HCPC U0002, $51.33. HCPC U0003, $100, effective date the 14th of April 2020. HCPC U0004, $100, effective date the 14th of April 2020. CPT 87635, $51.33. HCPC G2023, $23.46. HICPICCI 2024, $25.46. New codes will be added once CMS rates are assigned. Diagnosis code for confirmed coronavirus. B97.29, other coronavirus. B34.2, coronavirus infection. U07.1, 2019 COVID acute respiratory disease. Diagnosis codes for suspected coronavirus exposure. Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. Z20.828, contact with and suspected exposure to other viral communicable diseases. CPT/HICPIC applicable for coronavirus. HICPIC U0001, CDC, real-time RT-PCR diagnostic panel. CDC approved labs. HICPIC U0002, CDC, real-time RT-PCR diagnostic panel. CDC non-approved labs. HICPIC U0003, infectious agent detection by nucleic acid, DNA or RNA, severe acute respiratory syndrome, amplified probe technique, making use of high-throughput technologies as described by CMS. HICPIC U0004, any technique, multiple types or subtypes, non-CDC, making use of high-throughput technologies as described by CMS. CPT 87635, infectious agent detection by nucleic acid, DNA or RNA, severe acute respiratory syndrome, amplified probe technique. HICPICCI 2023, specimen collection for severe acute respiratory syndrome coronavirus, any specimen source, to be used by clinical diagnostic laboratories. HICPICCI 2024, specimen collection for severe acute respiratory syndrome coronavirus, from an individual in a skilled nursing facility, or by a laboratory on behalf of a home health agency, any specimen source. Backbencher note, the COVID-19 RT-PCR test is a real-time reverse transcription, polymerase chain reaction, RT-PCR, test for the qualitative detection of nucleic acid from SARS in upper and lower respiratory specimens. All payers continue to reimburse network clinics and facilities for all other covered health services, in accordance with their contracts. COVID-19 diagnostic testing codes are included in the CMS group rates. COVID-19 diagnostic testing codes will not be paid in addition to the DRG, per diem, per case rate payment, but only for single unit COVID-19 diagnostic testing, which does not include any other respiratory panel testing. COVID-19 antibody testing reimbursement. FDA-authorized serological tests may be used to determine who has developed an immune response to COVID-19. Antibody testing is not a replacement for the COVID-19 diagnostic testing, and should be used when such tests are medically necessary, in order to support diagnosis or treatment for COVID-19, or for treatment of another disease, when information about COVID-19 antibodies may impact the future outcome of that treatment for a particular person. It is not considered medically necessary if a COVID-19 antibody test is to be used as part of return-to-work programs, public health surveillance testing, or any efforts not associated with disease diagnosis or treatment. The American Medical Association, AMA, recently released 2 new CPT codes, effective April 10, 2020 for COVID-19 antibody tests. 86328 immunoassay for infectious agent antibodies, qualitative or semi-quantitative, single-step method, for example, reagent strip, severe acute respiratory syndrome coronavirus. 86769 antibody, severe acute respiratory syndrome coronavirus. CPT code 86328 should be used for antibody tests, with a single-step method immunoassay, typically a strip with all necessary components for the assay, appropriate for a point-of-care testing platform. report 86328 once per reagent strip. If more than one reagent strip is used, modifier 59, distinct procedural service, should be appended to the code for the second reagent strip assay to identify 2 distinct analyses were performed. Code 86769 should be used for antibody tests with multi-step methods. When 2 distinct analyses are performed, for example enzyme 86769 is reported on 2 claim lines, with modifier 59 appended to 86769 on the second claim line. Blood sample collections are reported with CPT code 36415. Collection of venous blood by venipuncture, or 36416, collection of capillary blood specimen, for example, finger, heel, ear stick. Reimbursement rates for COVID-19 antibody testing are CPT 86328, $45.23, effective date the 4th of October 2020. CPT 86769, $42.13, effective date the 4th of October 2020. A few payers have waived all member cost sharing, including co-pays, co-insurance and deductibles, for COVID-19 diagnostic testing provided at approved locations, in accordance with CDC guidelines for all commercial insured and Medicaid and Medicare members. A lot of payers are also supporting self-insured customers choosing to implement similar actions. As a billing, coding and adjudication specialist, review internal policy to understand claim submission and reimbursement of COVID-19 claims. For training and certification on U.S. healthcare, visit us at ibackbencher.com.